Or click on the uptake here on AM 950 KTNF. Here's your host, Mike McEntee.
Hey, lots of headlines today here out of Washington, D.C. The Senate Finance Committee has passed the Max Baucus health care bill with all the multiple amendments that went with it, and it actually got a Republican vote. We'll be getting into that in a little bit. Also here locally, I want to direct you to the UpTake.org because we're not going to have time to get into this story today, but did you know that our Minnesota Department of Transportation is supposed to make sure that its contractors hire a certain number of minorities every year, and that the Minnesota Department of Transportation has missed that mark for 17 years in a row? Yeah, hearing on that today, amongst other things, and if you go to our website, you'll be able to see not only the hearing, but you'll be able to see a group called Isaiah talking about how to remedy this problem. So that's not on the show today, but do check that out at the uptake.org. Also, Governor Tim Pawlenty, our governor, came up with his own health care proposal today. We'll be talking to Representative Huntley about that and find out why selling insurance across state lines may not be the best idea. That's all coming up here on the show. But first, I want to welcome to the show Steve Francisco, who is the Federal Policy Director of the Minnesota Council for Non-Profits, because what we wanted to do is talk a little bit about nonprofits and health care and this bill that just got passed in the Senate Finance Committee. Steve, welcome to the program.
Thank you, Mike.
How you doing today?
Good, very good.
Good. Did you, they did, other than just passing the bill today, I know they really didn't make any changes to it. So the bill that we've been talking about is pretty much the bill that's been there for the last week or so. How would this bill or any of the other bills that are in Congress right now have an impact on nonprofits in Minnesota?
Well, they affect nonprofits from a couple of different perspectives. Nonprofits are also employers. In fact, there are quite a few of them. There are about 4,000 nonprofits in the state of Minnesota, and the Minnesota Council of Nonprofits, who I work for, we represent about half of those nonprofits, just under 2,000. And so, they're grappling with the same concerns that many small businesses are dealing with, seeing their health insurance premiums jumping significantly from year to year. And just as with small businesses, there are not too many nonprofits that can sustain those kind of financial hits year after year. So anything that will help us get a handle on the skyrocketing costs of health insurance premiums is something that nonprofits are interested in as employers. But nonprofits are interested in expanding health care too to people who don't have it in Minnesota and across the country. Many of our nonprofits are service organizations that serve low and moderate income families, including families with children. And so we have a deep concern in making sure that we start whittling down that number of 45 to 47 million Americans who don't have health insurance. We want to reduce that as much as we possibly can.
Now, the number of people in Minnesota who get health care coverage took quite a big hit, or will take quite a big hit, in April when General Assistance Medical Care, also known as GAMC, goes away, not because it's been pulled out of the law books, but because Governor Pawlenty has decided to veto the funding for it. Is there anything that's in this health care bill that's going through Congress that might actually provide some relief to those folks and the hospitals that are very dependent upon those dollars coming in?
Well, there actually is. In the major bills that are moving in both the House bill and the Senate bills, there are provisions that would expand eligibility for Medicaid up to 150% of the federal poverty level in the House bill. And that's significant because a lot of the people that were cut off by this decision to terminate GMAC, which would take effect early in 2010, a lot of them are childless single adults. Many of them are people with mental and physical disabilities, and it's just inconceivable that they're going to be able to find insurance out there on the market, that we're going to have to expand the Medicaid program to help cover those folks. The good news about it for the state of Minnesota would be that the federal government would actually assume 100% of the costs for at least the first 2 years under the House bill, and then would pick up 90% of the costs of expanding the Medicaid program beyond 2013.
Because otherwise, doesn't what the healthcare reform that's happening in Washington kind of become an unfunded mandate for the states? I mean, is that what that's trying to avoid?
It is. That's a concern that they have. We think that the federal government is much better positioned than Minnesota and other states right now that are grappling with these huge fiscal challenges to their state budgets. We've seen income tax revenue has plummeted, sales tax revenue has fallen, all of it directly attributable to the recession that we're in right now. And so the federal government can be very helpful to the states. You'll recall earlier this year in the stimulus bill, there was actually an increase in the federal matching rate for Medicaid, which actually brought in $2 billion to the state of Minnesota. Think of what would have happened if we hadn't gotten that money. Instead of dealing with a $4 billion budget deficit in Minnesota, we would have been looking at a $6 billion hole that we would have had to try to close.
Yeah, very few people remember, well, remember is maybe not the word, but are aware of how bad things could have been without the stimulus package here in Minnesota. You saw the headlines maybe today in the Star Tribune about how many jobs that stimulus package did result in Minnesota. So that has been, despite what people are saying about, oh, gee, we're throwing money away, that has been probably the thing that's kept the state, not just the state government, but also the state economy afloat here at this point, at least when I'm looking at it. It's certainly, I don't think we'd be generating those jobs manufacturing cars here in Minnesota.
No, and it's doing things that need to be done. I have the story in front of me right now, too, today's Star Tribune, where it says that the stimulus bill was directly responsible for creating 11,800 jobs. And, those are folks who would continue to be unemployed, drawing unemployment insurance rather than working. And so that's significant.
Yeah, people forget it's not just that people are out of work, but it's that they are a drag on, essentially, on the finances of the state because they are taking in money that way. When you get them jobs, they are doing the reverse. They are contributing to society. They are contributing to the state coffers. And they are also contributing to getting things done, whatever it may be. I mean, people point to the Work Projects Administration back in the 30s as a great example of this. And it wasn't, some people called that make work projects, but I don't think a lot of people can point to our national parks and call them make work. I think it was work that just needed to be done, that suddenly we had some time and some people to do them. And we're kind of at that same spot right now with transportation. A lot of those projects are getting done because now there's some time and some money to do them.
Right. You mentioned the WPA, Mike. Actually, that touches close to home because my own grandfather, living in Minneapolis in the 1930s, he worked on a WPA project that actually built some of the stone retaining walls around the east edge of Lake Calhoun. And I believe some of those walls that he helped build, they're still there all these years later.
Wow, that is a strange connection because my grandfather in St. Cloud did very much the same thing for one of the parks up there. He was in charge of that and oversaw that they put up the stone walls around the parks that still stand today in St. Cloud. And so it's nice to see that that work stands the test of time. And we've talked before, but I just didn't realize that we both had grandfathers that did that kind of stuff.
That's right. How about that?
Yeah, small world. Another question, I wanted to bring this back, though, to the health care plan. And I talked to you the other day, and briefly you mentioned that it's possible that the bills that were in Congress right now, they may be treating nonprofits different than other businesses. Has that been ironed out, or is that still a problem?
Well, it's still a problem. It hasn't been solved yet. Basically, the issue is that in the House bill, the so-called tri-committee bill that moved through 3 committees of the House, there are provisions in the House bill that would provide subsidies for small employers to help them purchase health care coverage for their workers if they don't already provide it. The problem is that they left nonprofits out. We actually make up about 10% of the economy. About 10% of the jobs right here in the state of Minnesota are people who work in the nonprofit sector. And so what we're asking for is simply to be treated similarly to small business. Nonprofits don't have an easier time affording skyrocketing health insurance costs than do small business. And so we're looking for what we would describe as parity there. Now, over in the Senate side, the Health Committee bill in the Senate is written in a different way so that it does open the possibility that small nonprofits could be treated in a similar fashion as small business. And we think that's a good idea. We think it's good public policy.
Now, do you think when you're looking at both of these bills, I'm not sure how familiar you are with the politics of it, that one is going to prevail more than the other? The Senate bill, it's often talked, might prevail because they have to get 60 votes there, but is that how you see things too?
Well, I don't know who said this. You know, they say all I know is what I read in the newspapers, but it seems that from the beginning of this debate, there's been this great expectation about what would be in the Baucus bill that came out of the Senate Finance Committee today. And it is significant because we're at a point now where 5 congressional committees, 3 in the House and the Senate Finance Committee and the Senate Health Committee, 5 committees of the U.S. Congress have now reported health care reform legislation. I was working out in Washington when they were trying to do Clinton health care reform back in 1993 and 94. We couldn't even get one committee to report a bill. So I think the odds have increased significantly that we're going to get some kind of bill. Now, that being said, there are some significant problems still, I think, with the Baucus bill and the Senate Finance Committee bill. The tax credit provisions in there for low-income families so that they can find it more affordable to purchase health insurance need to be improved. They're frankly not strong enough. And, you know, the last thing we want to do is hold out this prospect that people are going to be able to get insurance, but then they're going to find out they can't afford it. So there have to be adequate provisions made for low and moderate income families so that they can actually purchase health insurance, especially if we're going to have an individual mandate, which is basically going to require people to buy acceptable health care coverage.
Steve Francisco with the Minnesota Council of Nonprofits, thanks for giving us the perspective here on what the health care bill means to nonprofits and also what it means to those who are without. We'll be back in a few minutes. You're listening to Quick on the Uptake.
Did you know that the largest living space in a typical home goes unfinished? Most homeowners don't realize the potential living space that can be unlocked in their front and backyard. Your landscape can be a place for fun and relaxation, not just mowing. Call C&L Outdoor Design and Landscapes to find out how you can create a beautiful outdoor space to enjoy. Call 612-282-5464. Mention AM 950 and receive a free on-site consultation and a $100 discount on a full landscape design. Visit cloutdoor.com.
Aurora Jewelers wants to tell you a secret. You can capture a memory or preserve an emotion with Camellia charm bracelets and necklaces. Aurora Jewelers will help you select one simple charm that commemorates a special day in her life. A charm that celebrates her birthday, commemorates her graduation. Capture the beauty of her wedding day. Aurora Jewelers. Express yourself. Express your love. Aurora Jewelers. Across from the Eden Prairie Mall or visit online at aurorajewelers.com.
We've all seen our investments and savings lose value in these tough economic times. Hi, I'm Jay Johnson, 36th Director of the U.S. Mint. I supervised our nation's gold supply, and I'm often asked why I buy gold. I buy gold because it helps protect against inflation and huge government spending. And gold is a safe haven asset that has never dropped to zero. In fact, gold has tripled since 2001. Some experts believe gold may be on its way to new record highs. Make gold a part of your portfolio. Call Goldline, a company with nearly $500 million in annual sales. As a former director of the U.S. Mint, I chose Goldline as a client because Goldline has been helping people acquire gold for nearly 50 years. Call Goldline at 800-556-GOLD to receive your free Gold Investors Kit, including important risk information about acquiring precious metals. Call 800-556-GOLD, 800-556-GOLD. Call now, 800-556-4653.
Here's a quick look at your weather forecast from the AM 950 Weather Center. Tonight, a 30% chance of snow, mostly cloudy, and 34. Tomorrow, a slight chance of rain, mostly cloudy, and 43. Tomorrow night, rain and snow likely, mostly cloudy, and 36. And Thursday, a chance of rain, mostly cloudy, and 44. That's been a quick look at your weather forecast from the AM 950 Weather Center. AM 950 KPNF, the voice of Minnesota.
Here's a look at traffic brought to you by Dex. They cleared up a crash northbound 494 at County Road 6. Everything looks good, but you're still slow back to Carlson Parkway. North 169 in Brooklyn Park, pretty slow from 77th Avenue to County Road 81. Going to see delays west 94 from Huron over to the Lowry Tunnel, and southbound 35E from Randolph to Highway 13, heavy traffic. Find everything local every which way in the book at DexKnows.com and on your mobile at m.dexknows.com. With Dex, you always have the local info you need when and where you need it most. Dex knows.
Hey, it's 21 minutes after 5 o'clock. Thanks for joining us here. You're listening to Quick on the Uptake. I'm Mike McEntee, and we're on the course, the voice of Minnesota, AM 950 KTNF. Did you know that Minnesota has regulations, or at least requirements, that a certain number of the employees that Minnesota Department of Transportation hires through its contractors should be minorities? I mean, this dates back to affirmative action laws, and it's also a part of what the stimulus is requiring, is making sure that those dollars get distributed to areas that, well, are a little bit more poverty-stricken than others. What's weird is, though, apparently the Minnesota Department of Transportation for the last 17 years, this is what I heard in a hearing today, has missed their targets on making sure that minorities are hired. We've invited to come on the show the Reverend Paul Slack, who's with the New Creation Church and with the group called Isaiah, which is a collection of congregations who have committed themselves to each other in order to build a powerful worldview that prioritizes racial and economic justice. Reverend Paul Slack, welcome to the program.
Thank you very much. I'm glad to be on.
Now, did I quote that statistic correctly, that the Department of Transportation for the last 17 years has missed its mark in terms of hiring minorities?
Yes, that is correct, and actually officials at the Minnesota Department of Transportation do not dispute that fact.
So what is going on here? Why are we having so much trouble hiring minorities for these jobs? Are there no minorities out there for these jobs? Is that the problem?
Well, quite the contrary. We've talked with a couple of training organizations, and also have been a part of what's been called a stakeholders table, where we work with unions and others who have identified that there are many trained minorities and women who are available to work. Federal legislation has strongly recommended to all DOTs that they set aside a half percent is what it is, to actually get those people trained and into those trades. There are training organizations around the state that have already been doing that work, and so kind of incentivizing this effort from contractors, construction companies, etc., to actually hire the people who are available. Actually, Minnesota Department of Transportation will pay them a certain amount of money, and one of the things that has been the case is that contractors have not been held accountable for actually meeting the goals. There's been more focus on doing what has been called good faith efforts, as opposed to ensuring that goals are met.
So we have people following the law but not actually getting the results that are intended by the law, is what I'm hearing.
Right, that is absolutely correct. And the term that's the phrase rather that's been used that I've been hearing at least frequently for the past 4 or 5 months is that MNDOT has been following the law, and on a factual basis, that is depending on which law you want to look at. That is pretty factual. They are following the law. They're doing what is required. And if you were at the hearing today, you saw that what they presented was 1 month, facts for 1 month, and then 1 week out of that 1 month is what reported on the actual number of people that were on the jobs. But even that did not have how many work hours those people represented when we talk about minority and women communities.
Now, we're also dealing with a problem here on transparency, too, because it took a lot of effort by your group to find out exactly how many people, minorities, are being employed by these various contractors. That information is not readily available, is it?
It is not readily available, and we're actually looking for minorities and women, and actually also looking at low income. One thing, but before I speak to that directly, is the construction industry is actually looking at a significant number of people who are working in highway-heavy construction right now, who are actually going to be retiring in 5 years, maybe a little bit better. And so there's a very, very strong need and self-interest, if you will, of Minnesota, that it actually begins now putting people on those jobs in those places so that we can have the workforce that we needed. And that also means that there's a huge opportunity right now to diversify the workforce in a way that matches the demographics of Minnesota. Well, yeah, you know, we really need to reach out and take advantage of this key opportunity where we're actually putting people to work, benefiting communities that need to be benefited, and also benefiting our state.
Now, if I heard you correctly, the state offers some sort of reimbursement or some sort of subsidy for companies that actually go out and hire minorities and hire women like they are, you know, they should be doing. Yet it doesn't seem to be happening. Why is that?
We've actually been trying to get to the bottom of that for a long time. We have some anecdotal reasons as to why, because really getting inside of the why construction companies, contractors actually are not hiring, I think that's more of a question of construction companies, and we've been in conversations with them at the stakeholders table as well. They had a few representatives at the hearing today. Anecdotal, what we believe is they're actually, contractors are actually not going out to the places enough where they can find minority and women workers who are trying really to get into these industries. There's some other things that they've talked about. When you talk about construction work, being able to retain people in construction work takes some real strategies. It takes some real intentions on doing what's necessary to actually get people in the industry and then retaining people in the industry. So those incentives are actually focused on those who are just at entry-level positions getting into the construction field. And so there are a lot of issues around diversity. There's a lot of issues around helping them get back and forth to the actual construction sites if they're just getting into the industry. Some of them may not have cars and that kind of stuff, and I don't think that speaks to all of them. But those are just some of the issues that they're facing, and then finding somebody there who's actually going to help them navigate through all of the issues, not just work-related issues, but relational issues. Many times, you know, when people show up on those jobs, you know, they are in the minority in terms of who they see on the sites. The industry is still heavily male and white. So actually finding people that's going to connect with them and help them build the relationships, really reach out to them and help them be successful in those industries. But specifically for those things, one of the things we've had some long conversations with contractors, with union organizations, with apprentice organizations about ways to actually partner with and mentor the groups that we're talking about to help them be successful in the industry.
Okay. Well, we've been speaking with Reverend Paul Slack, who is with the group Isaiah, which today was in front of a Minnesota Transportation Committee talking about how we need to do better. We need to do better than we are right now in terms of hiring minorities, hiring women, and making sure that the dollars that are being spent on transportation get to the areas that actually are poverty-stricken and need that kind of support. Reverend, thank you very much for joining us today.
You're very welcome, and we're really hopeful that we're really going to be able to make a difference in our industry. It's not just going to benefit women, minority communities, but it is going to greatly benefit our state once we make these transformative changes that we're advocating for.
Okay, well, thank you very much. That's it for today's Quick on the UpTake show. I'm Mike McEntee. We'll see you again here tomorrow at 5 o'clock. And, of course, Mom, thanks for listening. We'll see you then.